The Ambulatory Care Clinic is a model of social justice. Since it opened, the clinic has been removing barriers to ensure a marginalized group of people receive quality care at the Bonnyville Health Centre. The Ambulatory Care Clinic serves people who require outpatient IV treatment. Previously, only the emergency department provided this treatment, and that meant patients often waited hours as limited resources meant critical cases took priority. This was challenging for patients who had to book time off work or schedule transportation, and many were reluctant to receive treatment. Through creative use of existing resources and collaboration with the booking office, this dedicated outpatient IV clinic has increased the options for treatment times, established stability for patients, and created an environment where all people have equal access to quality care.
When her co-worker died in a motorcycle crash in Laos, Jill Watson, a registered nurse in the labor and delivery unit at the Grey Nuns Hospital, commemorated her friend by becoming a social justice champion. Sage Lowry went to Laos to work at the Laos Friends Hospital for Children. When she died in a motorcycle crash, Jill honored her memory by having a Be Kind pin designed that friends and co-workers could wear in remembrance. The idea grew into the Kind Like Sage initiative, a fundraiser that has so far raised $35,000 for the Laos Hospital for Children. Jill's Be Kind idea that honored the service and legacy of her colleague has since spread across organizations and around the world. Dr. Suresh Nayar is a maxillofacial prosthodontist at IRSM at the Misericordia Hospital. He improves the lives of patients with head and neck cancer by developing prostheses to replace missing areas of bone or tissue. But his commitment to social justice is also making a big difference, as he founded the first head and neck cancer support society in Canada. Dr. Nayar dedicated hours of his own time and energy to this endeavor. He acquired funding to establish the network and develop a website, and he is committed to improving visibility for head and neck cancer survivors. On September 26, 2018, the City of Edmonton lit up the high-level bridge in recognition of survivors, and on September 28th, the inaugural day of the Head and Neck Cancer Support Society, Mayor Iveson declared it Patient Empowerment Day.
For Dr. Eleanor Stewart, a clinical ethicist, social justice isn't just part of her job, it's her way of life. Dr. Stewart gives a voice to patients, residents, and their family members, ensuring the most vulnerable are heard when it comes to decision-making about their care. Her advocacy and support knows no bounds and brings peace of mind to both patients and staff. Dr. Stewart's passion for education enriches others, whether she's leading sessions to help staff flourish or teaching grade 9 students about the dangers and effects of human trafficking, a cause close to her heart. A champion for social justice, Dr. Stewart is recognized as a relentless and compassionate advocate for fairness and equality. When Alain Nug and Peter Adams started a men's group at St. Joseph's Auxiliary Hospital, their commitment to social justice helped them create a safe space for men to share their thoughts and socialize. Already facility volunteers, the two were not afraid to take on a new commitment. They were familiar with many residents and saw a need for the men to connect. The group meets to talk about topics from legalized marijuana to in vitro fertilization, share concerns and discuss feelings. The group is open to everyone, but because it's about discussion, Alain and Peter make difficult decisions when a member's declining health means he can no longer contribute. The men's group is a unique program giving residents camaraderie, purpose, and hope.
Lori Insole, a psychiatric aide at Villa Caritas, advocates for social justice for patients on Unit 2A by showing how they can contribute to the world around them. Lori motivates residents to participate in activities that focus on their strengths, including art projects using art tools she personally provides. She also initiated a coffee program that encourages patients to socialize and invites them to work with staff to make coffee and occasionally bake snacks. Her understanding of patients' needs has led her to go clothes shopping for a patient, returning with items that, to his delight, matched his style. She also leads walking tours and field trips to Tim Hortons. Lori's attitude is helping break down boundaries that limit what psychiatric patients can do. Dawn Noon is a model of social justice for residents of Youville Home. As a recreation attendant, Dawn ensures all residents are included in activities, no matter their mobility issues. With an ever-present smile, and often dressed up for crazy shirt or crazy hat day, Dawn will take residents where they want to go, whether driving a bus to the countryside or pushing their wheelchairs to the next activity. Dawn willingly takes on all jobs. He shares the latest news, MCs events, serves coffee, and advocates for the gardening program. Dawn encourages residents to work with him in the garden and strives to create better accessibility to the program for wheelchair-bound residents.